Hello everyone. Recently, I've been seeing lots of videos, and when I talk to people, they say that they have been into, especially the conventional doctors and the interns or students. They always say that, we are doing a lot of hard work and we have cleared the NEET exam, and we spent so many sleepless nights studying, and then we are doing 36 hours of internships. Our PG is very difficult, and so many things you know do you think that the Ayush system is very easy? If you feel that it is easy, why don't you take the admission in Ayush systems? And another thing, when you feel that Ayush is easy, you know, you will see that when you take admission into Ayush systems, there is a lot of cooperation from the teachers. There is no harassment as such, and even if it is there, it is very rare. So you will find more of the suicides. You will find the ragging from the seniors, students, and from the staff. More in the conventional system. It is not so in the homeopathy, or in the Ayush systems. So when you compare it in that way, then you will surely feel that it is a very hard to do the conventional system of medicine or do the education in the conventional system. So stop blaming the other systems, that saying that it is, you don't face the hardship as we do. No, it's not like that. In the Ayush systems, especially I'm talking about homeopathy, you will find more subjects in the curriculum of homeopathy. And apart from that, they are also, doing the CCMP 1 year extra to study the pharmacology from the conventional system. So why they are doing that? What is the need of it? Because these doctors have been working in the rural area, and they have the training from the hospitals. They know the system of treatment. They have been giving this, injections and all the kinds of treatments, antibiotics, and they have been practicing since long years, more than 15 years. And then most of the doctors have appeared for the CCMP exam. And the surprising thing and shocking thing I see here is those hospitals where these centers of training are there for the CCMP course, and all these doctors are going there for training. They are learning it legally, and these doctors who are teaching them are also the MBBS and PG doctors. And let me see that these doctors are also standing for strike against these homeopaths. Then why are you teaching the homeopaths when you are not willing to give them the CCMP certification, when when you are not going to give register them under MMC? So this doesn't look something. Are you afraid of your MAD and IMA and all that? Hmm? So stand united, dear friends. You stand united for what you are doing. You have been teaching all these years to these CCMP students, and now you are standing against. So I just saw a video of the Rajiv Gandhi Homeopathic College and Hospitals doctors standing outside and raising slogans and all that. And these doctors themselves are training the homeopaths. What for? Is it for the money that they are paying you? Like, absolutely doesn't have any value system. So don't do this. If you really have the guts, go and practice in the rural areas, absolute rural areas where these doctors are practicing, these homeopaths are practicing. And there are areas in Maharashtra like Konkan area, Ratnagiri, Srivardhan, and all these areas we see every 2 kilometers there is one homeopathic doctor who is practicing. There are even no hospitals in these areas. I myself have seen this. So, where will these patients or people from these areas go to? Most of these patients, people from these areas, go to Mumbai for treatment. So it's a horrific situation, dear doctors. Understand, if you don't want to practice, go into the rural areas and practice. Let the Ayush system doctors practice in the rural areas. Let them give them their service to these poor people in these rural areas. So this is my kind request. Understand the situation of the country and do the needful. Thank you.